Hi everybody, my name is Jen and I'm 25 and I'm getting ready to have a laminectomy discectomy on my L4-L5 in about a week. And I wanted to share this because I found a lot of help and reassurance from seeing other people's videos on YouTube. And I'm definitely not one to make YouTube videos or do anything like this, but that's how much I felt like the other people's videos helped me. So basically my story is that about 3 years ago when I was still in college, I was rowing at the gym and my back was really sore for the rest of the day, and I got home, I was sitting on the floor, putting books away on a bookshelf, turned to just get up off the floor, and immediately felt probably the most excruciating pain of my entire life. I couldn't move. My entire back seized up. It was spasming. I felt like somebody was stabbing me over and over and over again, and had to have my husband help me get off the floor because I couldn't even move. And I was in the fetal position crying for a long time because I had never felt anything so horrific. Saw a doctor, didn't diagnose anything, told me it was a muscle strain, and I basically had to suffer for several months with no help, no rehabilitation, nothing. And eventually I did get better. It was months before I was able to run or work out or do anything like that again, but I did get better, which makes me think maybe it was just a pretty bad bulging disc at the time. And then it was probably at least a year and a half before anything ever happened again. This past October of 2013, it started to flare up again. Went to the doctor, got a steroid, and eventually was okay again. And then again, several months went by, and then this past July, um, I think it was a combination of a few things. I went tubing, and then I also went running, and probably about a half mile into my run, I knew something was wrong. It just hurt a lot, and stupid of me, I kept going. And of course, over the next couple days, I started feeling the kind of twinge of spasms coming again. Could barely walk, but this time I was having extreme leg pain too. I was having like crazy nerve sciatica down my leg, and when it didn't go away is when I realized there's something definitely wrong. I could barely walk, I could barely sleep. I went to the doctor, finally got them to give me an MRI, and surprise, I had a huge herniated disc in L4-L5 that's causing severe spinal stenosis. And so, of course, being 25, I didn't want to jump into surgery, so I went and did, I did the steroids. They made me feel great, but you can only take them for so long, and they don't actually fix the problem. They just make you feel better. And then I also did the epidurals. They did absolutely nothing. The first one being generous, maybe lasted a week. A couple weeks later, I got the second one because my insurance only approved me for 2. The second one literally lasted for 2 days. I felt great for the first day, started feeling a little iffy the second day, and then I was right back to it again. And I'm a teacher, so I don't have tons of physical stress in my job, but, I'm standing and walking around all day. And it was getting to the point where, I'm having to sit down all the time, and, I just couldn't take it anymore. I finally went and got a second opinion from a different neurosurgeon, somebody who my dad had seen, and basically they told me kind of right away, you've exhausted your options. It's pretty much time to have surgery because nothing else is going to fix this. And luckily I did, because the first neurosurgeon told me that I would have a microdiscectomy, and the second surgeon told me that that's probably not a good idea because of how herniated it is. Going in to take out the ruptured part in such a small opening would likely, not 100%, but could cause more nerve damage if they, take it out and hit it against that nerve or hit it against something else. So I'll be actually having a laminectomy discectomy, where they go in and I guess cut out much more of the lamina than the microsurgery does. So of course I'm getting a little nervous going up to this, but I realized yesterday's, and I saw someone else's video last night, and it made me feel so much better because I went to the grocery. I mean, simple things have become impossible. And actually, one of the reasons I wanted to do this video also was so that in like a year, hopefully I feel better and can watch this and remember, you know, just how miserable I really was at this point. Yesterday I was at the grocery and was pretty much on the verge of tears all the way through the grocery store. It hurt so bad to walk. Luckily I had the cart to hold on to. But, you know, every twist, every turn, trying to lift up, you know, a 10-pound thing of soda into my cart was like the most difficult thing of my life. So by the time I got home and then had to get it all into my house, I kind of broke down and flipped out and cried, which is not me. If you know me, that's like, I'm the last person that would cry over pain. So that kind of reassured me that I'm doing the right thing, I hope, and I'm, you know, looking forward to feeling better, even though I know that I'll, you know, get rid of leg pain and kind of trade it temporarily for back pain, but that's okay, because I really want to start feeling better, because this is miserable. And my friends, if you've been around me for the last several months, I've been horrible. I complain a lot. I sit down a lot. I can't do anything. I can't walk anymore. Definitely can't run. Can't work out. I've gained a little bit of weight, which is 90% of the reason why I'm over this, and just ready to have the surgery. So hopefully this video will help somebody else make this decision, especially since I'm young. It's not like I'm, you know, a 50, 60-year-old person, but it does happen to young people. And like I said, I hope that this serves as a reminder to me why I did this, and helps somebody else maybe make the same decision if you're having the same symptoms. So anywho, I'll try to give you an update next week whenever I go in for the surgery and let you know how it went. Thanks. Bye-bye.